Okay, let's unpack this. Today we're doing a deep dive into a research paper looking at a really key resource for health in Europe.
Yeah, the European Social Survey's Health Inequalities Module. It's pretty important stuff.
Exactly. Think of this as, well, getting a clear view on a big challenge. Why health differs so much based on, your social standing
Yeah.
and how we track that.
And the mission today.
To pull out the main insights from the survey, especially because there's this fresh wave of data just
Right,
released.
and that new data couldn't be more timely considering everything that's been going on. But maybe before we jump into the why now, let's clarify the basics. What are health inequalities according to the source?
Good point. So the paper defines them as systematic differences, persistent differences in health that are tied directly to social position.
Like your job, education, income level.
Exactly. And the crucial thing the paper stresses, these aren't just natural variations, they're socially produced.
Right. They're linked to what researchers call social determinants of health, basically the conditions you live in.
Your housing, your work environment, access to healthy food.
Healthcare, all those factors. And it's interesting, it's not just a simple divide between the very top and the very bottom.
Ah, you mean the gradient idea.
Precisely. The research often shows it's more like a slope. Health tends to get incrementally better with each step up the social ladder, not just a rich-poor thing.
Okay, so how does the European Social Survey, the ESS, fit into this picture? It's a big survey, right? Covers lots of countries.
Huge. It's been running since 2002. But the key part for us is this special module they added in 2013-14, focusing just on health inequalities, the HANYEC.
And now there's a new one.
Yes, conducted in 2023-24. And having data from 2 points, like a decade apart, that lets researchers look at actual change over time. It's quite powerful.
So what health stuff does it actually track?
Well, it asks about self-reported chronic conditions, mental health, using a specific depression scale, actually, and health behaviors.
Like smoking, drinking, exercise, diet.
Exactly those. And the real strength is linking that health data to the social information the main ESS already collects: education, job, income.
The health module adds even more detail.
Yeah, it digs deeper into things like childhood health conditions, housing quality, even hazards at work.
So why is getting this update now so vital? What's happened in that decade between the two modules?
A lot, as you can imagine. The paper flags some major things. Obviously, the huge impact of the COVID-19 pandemic,
On health directly, but also on economies, access to care.
for sure. Then there are knock-on effects from conflicts, like the war in Ukraine impacting energy prices, cost of living, refugees.
We've also seen trends like rising income inequality in many places, more precarious work.
Right, insecure jobs. And questions about how expanding education affects those left with fewer qualifications. Plus, political shifts, ongoing issues like obesity.
So this data lets us see if those big events actually change the patterns of health inequality.
Potentially, yes. Across different social groups, across different countries, is a chance to see if certain policies may be helped or hindered.
Policies related to things like cancer screening, workplace safety, housing support.
Exactly. Are policies buffering these shocks for some groups more than others? It helps connect those dots.
Now, the paper does mention limitations, like any study,
Of course. A big one is that it's cross-sectional.
meaning they survey different people each time, not the same individuals.
Correct. So you see snapshots of the population, how inequality looks overall in 2014 versus 2024, say. But you can't track one person's journey.
Okay, that makes sense. And a 10-year gap is quite long, too.
It is, if you're looking for very rapid shifts. And it relies on self-reporting, which always has some, potential bias.
But even with those caveats, the opportunity here seems pretty significant.
Absolutely. Having this repeated module across so many countries provides unique comparative data. It lets us understand these complex patterns much better.
It moves beyond just saying inequalities exist to figuring out why and maybe what works to reduce them.
That's the goal, really, to inform policy and interventions.
So wrapping this up then, this dive into the ESS Health Inequalities module really highlights how vital these big social surveys are. They connect our lives, our social circumstances directly to our health.
It gives researchers and policymakers a map, showing where inequalities are biting hardest and how things might be changing, especially with all the recent turmoil.
And it really leaves you thinking, doesn't it? If health is so tied up with social conditions, things often outside an individual's control.
Yeah, what's the responsibility of society, of our policies, to make sure everyone genuinely has a fair shot at a healthy life? It's a crucial question.